That card allows you to go to the private doctors and hospitals and get health care. That is the Canadian system. Okay. We have a system like the UK does. It's called the VA system, also called TRICARE. So it's the system that the military veterans and active duty military receive is just like the UK system. The doctors and the nurses and the hospitals are government owned, run and operated, and paid for by taxes.
Okay.
And then we have a third system that's like the Germans, which is the private insurance system, which is the system that you're in. And the way that works is you have a job, your employer pays about 2/3 of your premium, you pay the other third of your premium, plus you pay your deductible and your copay. And for that card you then receive allows you to go to certain doctors and certain hospitals to get care.
Okay.
So that's basically the way we're set up. Now, your question, that's a long way to go to answer your question. Yeah. Your question was, why can't we just focus on the people that don't have care? And we have about 46 million people, because we tie health insurance to employment, right? We have about 46 million Americans that don't have don't have health insurance. They're not old enough to be on Medicaid. I'm sorry, Medicare. They're too young for that, and if they're unemployed or they have a job, but that employer does not provide insurance coverage.
Right.
They either have to purchase their own policy, which for most people is just more expensive than most people can afford, or they have to go without insurance. So if we provided, we do have a program for low-income people in this country, and it's called Medicaid. It's for the poor, and you have to be pretty poor to qualify for Medicaid. And what you're proposing is if we could just take the Medicaid program and make more people eligible for the Medicaid program, that would take care of people that have, about 75% of the people that are uninsured have jobs. So many people think that the uninsured are lazy people that don't want to work, and the majority, 3 out of 4 of the people that are uninsured have jobs. These are employed people, but they work for companies that don't provide insurance. So if we were to just provide a program for just that group of people, you would basically have the public option, right? Because that is what the public option is.
Okay, that's what I was going to ask, the public option, because that just, of course, today's date being the 30th?
Yeah, September 30th.
September 30th. Just last night, the Senate put the public option off the table. Of course, the Senate voted that public option, no public option.
Well, the Senate Financing Committee voted not to pass public option out of the committee. It doesn't mean it can't come back.
Okay.
But as of right now, it looks like the Senate.
Well, can you explain exactly what is public option?
So the public option merely means that there would be an insurance. Think of it this way, as an insurance company or a financing program that would be run by the government. But that program would be able to compete with all the other insurance companies. That program could then have different rules in terms of eligibility, so that people that didn't have insurance through their jobs would be able to be in the public option. People that maybe were unemployed could participate in the public option. And it would basically deal with the problem you're referring to, that 46 million people that could be covered under the public option. The other argument for the public option is that since it would be public, it wouldn't have as many administrative expenses. So you wouldn't have a CEO that would be making $20 million. You could sort of cap how much you're paying for administrative costs. You wouldn't have to pay for advertising and other expenses that private companies have that company wouldn't have, the public company wouldn't have. And then therefore, they would be able to keep their rates low. And by them keeping their rates low, the private sector would have to compete with the public sector, public option, and they would have to try to keep their premiums as low as possible so they can be competitive.
Right.
So that's what the public option is. Basically, it would be a government insurance company that would operate like any other insurance company, but it would be owned by the government.
Okay. So Kenneth, what did you get from that, from what Dr. LeVise actually said? What did you get from your question as a common, let's say for instance, if I'm sitting in my living room and I'm asking the same questions you asked, from his response, how did you interpret that?
Well, the way that I interpret it, and of course this was a question that I had asked a little earlier to Dr. LeVise, and he gave me a very extensive answer, and one that was very eye-opening. That what he told me was that because my health care is connected to my job, that if I have lost let's say I lose my job, I've been working on the same job for 23 years and I have never missed a premium. But if I lose my job, then I have to go somewhere else. And if I go somewhere else and go with what they term a pre-existing condition, they can deny me coverage, although I've been paying my premiums for 23 years.
Wow.
So I'm understanding now the need for reform, as he has said. And then when you hear about people who don't have the coverage, a lot of times there is the word laziness connected with that. But he's really begun to open up that understanding. Everyone who doesn't have it is not lazy. Some just can't afford it. Right? Some people just can't afford it.
Now, some of them choose not to get it. I mean, so you do have people that are unemployed. About a quarter of the uninsured are unemployed.
Right.
You have people who, some cases, could afford it, but they choose not to pay for it because they're young and they're healthy. They don't have health problems. They think that they don't want to incur that expense. So that is an issue, and that's the reason why you hear talk about a mandate. That you would mandate that everyone would have to have insurance, because if people choose not to have insurance and then they get sick, they're going to show up at the hospital, they're going to get care, and the only way to pay for that care is going to be either to go to the government to be reimbursed for that care, or to increase the costs for all the rest of us to pay for it. And that's what we currently do. Right. So if an uninsured person goes to the hospital and gets care, and they will get care in the emergency room, whether you have insurance or not, you go there, and the premiums that the rest of us pay are we each pay about $1,000 more per year in health insurance to cover people that are uninsured and show up in hospitals to get care. Wow. Wow. So we're paying for them anyway. The question is how you're going to pay for them, and do you do it up front where you understand what the costs are, or do you do it in this hidden way where the costs are kind of nebulous and not clear how.
And I think the most important question is the way we're covering them now, is it more cost effective? You know, is this the most cost effective way to cover them? Or like you said, it's almost like if you were to ask the average person, they would not know that we are covering these people because it's sort of blanketed.
Well, you know, so people are showing up in the emergency room to get care for things that are not emergencies, right? So that means that when you show up with a real emergency, the emergency room was clogged with people that don't have real emergencies, so that slows down the process for you. The other thing is that it's much more expensive. If you go to any hospital, depending upon which door you enter, the costs are going to be different. If you go into the emergency room, things cost, depending upon what it is, anywhere from 3 to 8 times more than it costs if you go in through the main entrance, simply because emergency rooms are set up to do certain things. They're set up to deal with emergencies. But if people are coming there with common cold or, you know, simple things that are not really emergencies, it's going to cost a lot more to provide that care to that, because they're being seen in a place that's set up to deal with very high level of emergency services, but they're only utilizing a very small part of it. But that room that they're in costs a certain amount of money to manage that room, whether it's a patient in there with a broken leg or a patient in there with a cough. So we want to keep people out of the emergency rooms that are not really emergency patients. And then that way you would keep costs down, because people are getting cared for at the appropriate place in the healthcare system at the appropriate price.
That's great. And you know, a lot of times I was thinking about what you said, Kenneth. You know, when I had a job, I had a healthcare, so I'm thinking, why is it that we can't just care for the people who do not have health care? But it's not all the time you're going to have a job, especially we can see right now where the economy is affecting health care. And something that President Obama is saying is that the two really are connected. I didn't see that at first, but now I'm clearly seeing it, because if you lose your job, like you said, what happens?